Hello, my name is Kathleen Augusto, and I chose to do my presentation on hepatitis B. The virus name is hepatitis B virus, and it's a member of the Hepatinovirinae family, and the disease cause is hepatitis B. The viral genome is a partially double-stranded DNA with highly complex genome organization, life cycle, and natural history. What is hepatitis B? It's a potentially life-threatening liver infection caused by the hepatitis B virus. It is a major global health problem, and it can cause chronic infection. As far as the symptoms, you can have acute hepatitis B or chronic hepatitis B. Those with acute hepatitis B usually do not experience symptoms. However, those that do may experience jaundice, which is yellowing of the skin and eyes, dark urine, extreme fatigue, nausea, vomiting, and abdominal pain. A small subset of patients that have acute hepatitis may develop acute liver failure, which may lead to death. Those with chronic hepatitis B may have a liver infection that can develop into cirrhosis or liver cancer. In order to get diagnosed with hepatitis B, you must get a blood test in order to detect the surface antigen HBsAg. The blood test can be used to distinguish whether it is acute or chronic infection. Acute hepatitis B virus can be categorized by the presence of HBsAg and immunoglobulin M antibody to the core antigen HBcAg. HBeAg marks the individual as highly infectious. Chronic infection is characterized by the persistence of HBsAg for at least 6 months, so it is the principal marker for developing chronic liver disease and liver cancer. And as far as treatment, there's no specific treatment for hepatitis B. The most you can really do is maintain the comfort and adequate nutritional balance. However, there is a vaccine to prevent hepatitis B. It's 95% effective in preventing infection. For chronic hepatitis B, it can be treated with oral antiviral agents to suppress the virus. World Health Organization recommends the use of oral treatments tenofovir and entecavir because it rarely leads to drug resistance. And those who start hepatitis B treatment must continue for life. Transmission. In highly endemic areas, perinatal transmission is how it is mostly commonly spread, and exposure to infected blood, an infected child to an uninfected child the first 5 years of life. Developing chronic infection is common in infants infected from mothers. It can also be spread by percutaneous or mucosal exposure to infected blood and bodily fluids. Unprotected sex is another form of transmission. Also, the reuse of needles and syringes in hospitals and those that inject drugs is a form of transmission, and it may also occur during medical and or dental procedures and tattooing. Hepatitis B virus can survive the body for at least 7 days. During this period, the virus can still enter a body who is not vaccinated. The incubation period for hepatitis B is 75 days on average. It can vary 30 to 180 days. It may be detected within 30 to 60 days after infection. What is the reservoir for the virus? The main reservoir is chronic carriers of the virus. Those who have been infected by the virus anywhere from 1 to 20 years. They may be asymptomatic. 10% of adults and 25% of children with acute HBV will develop chronic disease. 90% of infants that are infected become carriers or develop chronic disease. And that is my presentation. Thank you.